Okay, let's get started. So, hi everyone, welcome back to MS Neuro TV, brought to you by MS Views and News. I'm Anna Fernandez de Castro, the Assistant Development Coordinator at MS Views and News, and I'm here with our Director of Development, Jennifer Falk.
Good evening, everyone.
MS Views and News is a nonprofit organization dedicated to providing education and information for the multiple sclerosis community. Before we go any further, we would like to thank our supporters, Celgene, and viewers like you for making educational programs like this possible. We're so glad that you're joining us now and hope you have been enjoying the MS Neuro TV webinar series so far. Today, we're here with Dr. Brian Steingo to focus on young adults living with MS. Living with MS can be challenging, so we'll be discussing on how to manage the emotional, social, and physical aspects that many face. Dr. Brian Steingo has practiced neurology in Broward County, Florida since 1980. His practice is limited to treatment of people with multiple sclerosis. He completed residencies in neurology at the Medical University of South Carolina and Baylor College of Medicine in Houston, where he served as chief resident. Dr. Steingo has participated in many clinical trials, including the pivotal trials for several drugs now approved for treating MS. He has been actively involved with the National MS Society and currently serves as a medical director for MS Views and News. All right, so first we're going to start by playing a quick video interview with Dr. Steingo. If you have any questions that you would like to ask Dr. Steingo, go ahead and type them into the question box. After the video is done playing, we will be live with Dr. Steingo for a Q&A. In order to protect your privacy, your questions will remain anonymous. And for those of you who are calling in over the phone and do not have video access, please know that you will hear a few minutes of silence while we play the pre-recorded video interview. But please don't worry, stay on the line because once the video is done playing, you'll be able to hear us again during the live Q&A with Dr. Steingo. Okay, let's begin.
Neuro TV, presented by MS Views and News. MS Neuro TV is a comprehensive educational program bringing together MS professionals from across the United States covering the topics that you want to learn more about. To register for MS Neuro TV webinars, visit www.msviewsandnews.org. Thank you. We hope you enjoy the program.
Hi, I'm Stuart Schlossman, and we're here today to talk about young adults with multiple sclerosis, and we got Dr. Brian Steingo here to ask a few questions. And so I want to begin with, what is the average age of diagnosis for a MS patient?
So multiple sclerosis most commonly begins between the ages of about 20 to 40 or 45. There are much younger people described with multiple sclerosis, and there's certainly people over the age of 40 or 50, even in their 60s, 70s, and 80s perhaps. But most commonly it begins between the ages of about 20 to 40.
Great. So how does it affect, or how is it that younger people are being diagnosed with MS, or what is like an age that you're seeing most commonly these days of young people being diagnosed?
I mean, that's the commonest age group that we see multiple sclerosis diagnosed. The difference is nowadays that we have much better diagnostic methods. The major advance in diagnosing multiple sclerosis, of course, was MRI scans. We've had MRI scans since about the 1980s. Before that, it was hard to diagnose multiple sclerosis because there is no specific test for multiple sclerosis. There's no blood test, for example, that can be done, and some of the other tests can be overlap with other conditions. So it's still a hard condition to diagnose, and part of our criteria of diagnosing it is to rule out other conditions.
So, concerning young adults living with MS, what are their greatest challenges?
So young people are at a particular very important stage of their lives. It would depend, of course, on what we mean by young adults. If they could be in their 20s, they could be in their 30s. Even within that range, there could be a difference in the way the disease affects them. So people in their 20s are just maybe in college and looking forward to their whole life, starting a career, have not earned anything yet, and are looking forward to maybe earning an income and haven't even started that yet. People in their 30s may have already started, might have some income, looking forward to more income, maybe have started a family, and all of a sudden there's financial stress in terms of a family and bringing up a family and supporting a family. So those are two very major stresses that people are thinking about. Family life, financial aspects, are hugely important things that affect these young people.
So going forward, we're talking about those that are affected by MS and having to deal with the career and finding a job, or even talking about MS during their actual career. What challenges do you see there, and how might they get around those challenges?
So firstly, we should say that the treatment of MS has dramatically changed in the last 25 years. This year is a very good year. It's an anniversary year for our first drug for MS. Beta-serum was approved 25 years ago in 1993. So our management of MS is definitely better in many ways. So we have drugs that can help us manage the disease. We have many medications that can help us manage the symptoms. In general, in a society, we're more understanding of the importance of other aspects of MS, like emotional management, the importance of society, support, contacts. All these things have improved. So our management of MS has improved significantly to help people, to say to them, having a diagnosis of MS is just the beginning of a new chapter, is the way I would look at it, that there are many things that can be done rather than say it's the end.
Okay. So if a patient wants to approach a new job, do they disclose that they have MS at the beginning, or should they, wait later on? And, let's just talk about career first.
This is much better than it used to be. So if you go back many years to the 1980s and someone was diagnosed with MS, we didn't want to tell their employers at all that they had MS, because that implied at that time that this person was going to become, or had a high chance of becoming, disabled. So we were very reluctant to tell people that diagnosis. At that time, it didn't even make a big difference because there were no treatments anyway if you go back 30 years. Nowadays, we have treatments, so it's more important to disclose a diagnosis. Still, we find that there are many people in our society who are, let me phrase it in a polite way, who are backward, who still view someone with MS as a handicapped person and still treat them really not well. And so a lot of people still don't want their employers to know about it because they think they might be picked out. A company might not give them promotions that they need. And so I would say to most people, and hopefully most employers nowadays, are much more open-minded and good to declare the diagnosis so somebody can understand. There is still a lack of understanding about MS. One of those reasons is because people with MS generally look good. They don't look bad. They often don't look sick. And so someone looking at them would assume that they're well, but they may, on the other hand, be affected by conditions like fatigue or some memory problems, which can affect their performance. And it's important for their employers to understand that and be compassionate about that.
Thank you. Going to the flip side now, they're dating, okay, and they find somebody that they're interested in, whether it's male, female, female, male. Do you think that they should disclose the MS first, or when they first meet somebody, or if they should let their relationship blossom?
I mean, everybody's different, of course. All relationships are different. All people are different. I think that if someone determines that a relationship has potential to be their lifelong relationship, their, quote, soulmate, at that stage they need to declare it and tell the other person. If at that stage the other person leaves, disappears, that means it wasn't meant to be. So at some point they need to declare it. I think it's as soon as those people determine, well, this is my lifelong soulmate, then that's the time to declare it.
Okay, going back, thank you for that. But going back now to the actual disease, how does MS affect an MS teenager versus an MS patient in their 20s or one in their 30s? Can you tell us what you think about that?
So the first thing is peer pressure, of course. Is a teenager whose brain is not yet fully developed, of course, thinking that they're different from everybody else, having to deal with that because we know that teens, just being a teenager, is a hugely stressful time of life. Many teens have many problems just dealing with those years of their life. And now you add to that they could have a disease, which could be a lifelong disease. This is a huge burden, very important to offer them the right support. But some specific things could be, for example, fatigue. A teenager might suffer from fatigue and might not be able to do what their peers could do, for example. They might have to take medications that could affect them. For example, if they were taking injectable medications, they'd have to be doing an injection which differs them from their peers. So those are some of the aspects to deal with.
Okay, so going another step further, so the MS patient that's a teenager, what kind of, are they excelling? Their cognitive or their mood changes, or is it greater than, the teenager that does not have multiple sclerosis, and also that for the 20-year-old?
I mean, it can be obviously every person. One thing about MS that we do say is that it's an unpredictable condition, and different people are affected in very different ways. But we do know that MS can cause some what I would call invisible symptoms, the ones that are not obvious to other people. Cognitive symptoms are one of them. So a person that has MS, even a young person, might feel that mentally they just can't keep up. They need more time, they're fatigued, they could be heat sensitive. All these things may be invisible to other people around them. So in a young person especially that's just trying to become accepted by their peers, these could be excessively harder things to deal with, and it's very important that their caregivers are aware of this to make sure they get the right counseling and the right support.
So, and I don't know if you know the answer to this, but this is probably more for a school issue, but an MS patient that's a teenager and having these cognitive challenges and difficult learning possibly, and where they might then feel that they're not to the same quality as their peers around them, how do they get the schools to work with them?
So we can obviously help them in many ways, write letters on their behalf, write a letter to the school and say these people need more time for their studies, should be in a cool environment because they might be heat sensitive, shouldn't be outdoors during breaks. So we definitely write letters in support of their needs. We do this all the time. And then you're hoping on the other end you have a supportive group of people listening. And I can tell you that even here in our South Florida area, some school boards are really not compassionate. In the places where you expect absolute compassion, you sometimes don't meet it. And some of these people need to meet caregivers and physicians and speak to them one-on-one and say, how do we become compassionate school board or other board members and help these kids in their life?
Right. How do you help the patient, especially a young patient, to deal with living with MS, and how do you get them to understand that there's a full life to live?
I mean, I think a very important thing is support at all levels. So MS is the ultimate team disease. There's all levels of support. The more supportive that their caregivers are, namely their parents or parent, the more supportive they are, the better the kid will do. They need to have a supportive healthcare team. Even young kids, there's no reason a young kid couldn't have a physician, nurses, people that they could speak to as well. So the more support that they have around them, that somebody that they can speak to, somebody that they can open their hearts to, this is, I think, the way that they're going to cope with this. And for us at the beginning to tell them that, that we can do a lot for this condition. This condition is not the end of the road, it's the beginning of a new chapter. You can live a completely normal life. So these are things that are important to tell them that right at the beginning.
Right. So you're talking about bringing the family in to support the patient. How do you sit with the parents or with the siblings to, discuss all this with them and bring them all in and make it more adaptive, whether it be for a patient that is fully mobile or not fully mobile, but how do you bring them all in together?
So one of the problems with MS is that it is a time-consuming disease. So in a physician who's going to treat a person with MS, they need to be prepared. And most MS physicians who dedicate themselves to treating MS spend time with families and try and treat and teach them. These are the things that need to be done. It's the time. It's the time. It's the education. It's providing the support, letting someone know that the support is there, and then finding what the needs are, and then helping with those needs.
I think these are great answers. A lot of people do need to hear this, and families need to be more involved. What can you tell us about nutrition and diet for any MS patient?
I'm going to take a quick 10-second bypass from your question and say that I think that there's three things very important for people, three stresses that every person with MS and every person faces in their lives. And I label those three things as physical, emotional, and nutritional. And we've spoken a lot about the emotional support part of managing these people with MS. The physical part is very important, teaching people about the importance of exercise and the right physical activities, whether it be exercise or yoga or stretching, balance exercise, whatever they need, crucial. So physical exercise, emotional management, dealing with the stresses, how to deal with them, and then nutritional aspects, such as healthy eating. For example, I'll give you the one most important thing is vitamin D deficiency. So vitamin D deficiency, we know, is associated with an increased risk for MS. That is one of the factors we're learning about. Even in youngsters, vitamin D deficiency is very important. They've done studies in Scandinavia where they've shown that vitamin D deficiency in pregnant women results in an increased risk of their children having MS. So vitamin D deficiency is important at all ages. And the other things, we've now learned that obesity in adolescents increases the risk for MS as well. So therefore, dietary counseling is very important. As soon as we suspect anything or speak to family members, dietary counseling is very important.
Very good. And of course, smoking, we know not.
Right, that doesn't go with diet, but you're absolutely right. What we're trying to do now is look at risk factors, what are preventive factors. So vitamin D is important, very important. Obesity is important. Avoid smoking is important. Those are the most important ones that are avoidable factors.
Great. And so going back to the nutrition and the diet, what do you recommend?
So vitamin D, I said, is important. Other supplements, there's many other supplements that people can read about. There's no evidence that necessary supplements all help. There's large sales forces on the internet that tell people to take a whole bunch of different diets and supplements and power this and do all kinds of things to them that there's no evidence for. So vitamin D is important. Vitamin B12 is important for the nervous system and everybody, you and me and everybody. So B12 we should check to make sure the person that has a neurological disease has adequate B12. Other than that, we talk about mostly healthy eating. So healthy eating in general is to tell someone, and this goes back to the original MS diet. The very first diet for MS was called the Swank diet, written many years ago. And he said, Dr. Swank, avoid saturated fats. So I do recommend to people to avoid saturated fats. I recommend to avoid sugar and to minimize salt. I also recommend to them to minimize red meat and dairy. This is my personal recommendations. Some people might say it's not as important, but I think those are good eating habits.
Great. Thank you very much for joining us today.
You're welcome.
Awesome.
Excellent. And we are back. This is Jennifer Falk over at MS Views and News. And I just would like to thank everyone that is on the line with us tonight who has joined this webinar, and to thank Dr. Steingo for covering this really important topic and bringing his expertise with that awesome interview with Stuart. Thank you, Dr. Steingo. Are you on the line with us?
Okay, I'm here.
Yes, we can hear you. So, this is a very important topic, and, especially for young adults, juggling work, life, family, friends, all of it. I'm really glad that we're able to cover this tonight and bring awareness not only for people affected by MS, but for the general community to learn more and understand what this is like. So we have questions coming in. If anyone wants to type in their questions, you should see the question box on the right-hand side of your screen. There's an orange arrow. Just click on that arrow and it should make the question box available for you to type. And as I receive your questions, I'm going to read them off to Dr. Steingo. Dr. Steingo, we have a lot of questions coming in under the family planning topic. I have the first question is, does being diagnosed in the early stages of the disease have any effect when a woman becomes pregnant?
No, so there are some facts that we know. Firstly, there was a time in years gone by when people might even have encouraged families not to have children because of the stress and burden of managing children and being sick. Of course, we don't recommend that anymore. If we can keep someone on treatment, encourage them to eat well, exercise, and manage all the things that I talked about earlier, There's no reason that someone can't go ahead and have a family. We do know that during a pregnancy, most women actually do very well during a pregnancy. Pregnancy generally is a protected time, probably because of hormonal levels of estrogens. During pregnancies, most women do very well and tend not to have relapses. However, after the pregnancy for several months, there might be a period of increased relapses. So this results in us preparing appropriate medications to use before, during, and after the pregnancy. But we would discuss the family planning, the timing of the planning in terms of medications, when to stop medications, when to start medications, and the importance of nutrition. So all of these would go into a comprehensive family planning kind of idea.
Yes, and that leads into another question. What should I know specifically about MS medications before trying to conceive and during pregnancy?
So essentially, currently we would stop all the medications. We would counsel all women to stop medications before pregnancy. Depending on the medication will be the amount of time. Some medications might take longer to wash out, so we would say wait a certain amount of time before conception. Some medications wash out quicker than others, so that would go into the planning. If someone did need a medication during pregnancy, the only medication that really has been studied effectively is Copaxone, glatiramer. Glatiramer acetate has been used during pregnancy if we feel a need to use a disease-modifying drug during pregnancy. For the most part, with other drugs, no one uses them on a routine basis. There's multiple studies on drugs that have an effect during pregnancy and on the fetus, but currently the only one we would use on a routine basis if needed during a pregnancy would be glatiramer.
Okay, thank you. And can MS affect fertility, and what are the chances of passing MS on to my child?
I mean, the effect of MS on fertility is based on someone's general overall health. They might be on other drugs, for example, which can affect their ability to conceive. They might have physical problems that limit their sexual experiences. But in terms of fertility itself, the MS drugs as such don't usually limit fertility. There are some studies that have suggested that babies born to mothers on certain drugs might be smaller, slightly smaller than average. But other than that, in a woman just with MS, there are not many changes. When they're on medications, then we're worried about the effects on the fetus, and that would have to be a separate discussion. Some drugs are more liable to cause fetal harm than others, so that would be an important part of the discussion. MS is a disease that we don't fully understand what causes it. There are probably genetic factors involved, because we know that if someone has MS, their family members have a higher risk of developing MS, maybe increased about 30 times. So in the general population, as a rough number, we could say about 0.1% or 1 person in 1,000 has MS. And in family members of those with MS, it would be about 30 in 1,000. So the risk is higher, not very high, but it is higher. So it's important for family members to be aware of that, and therefore to follow appropriate diets, and both during pregnancy and as the kids are growing up, keeping them on the right nutritional pathway, because as I mentioned earlier, obesity in adolescence is associated with a higher risk. So if someone has a parent with MS and then they become obese, and then other risk factors such as they smoke, and let's say they're also vitamin D deficient, they're adding a whole bunch of risk factors in that can increase their risk for developing MS.
Okay, thank you. I'm going to shift a little bit into more invisible symptoms, but very important things that we still want to talk about. I have a question. Many people don't understand my fatigue because I'm young and usually look like nothing is wrong with me. How do you recommend explaining what MS fatigue is like to others?
So, as we said before, people with MS often look good. The National MS Society actually has a booklet that I, in my office, would give to people. It's called "But You Look So Good." And so it's to explain to those around you that even though you might look good, physically you might look good, that you could feel very tired. Sometimes your thinking could be slow. You could be heat sensitive, the so-called invisible symptoms. It's a good little booklet to carry around and hand to people to explain to them that even though you look good, maybe you don't always feel good. MS fatigue is hard for people to understand, but there are different ways that people use to explain it. such as they feel the same feeling one would have after exhaustion, but without doing any activities. So you could explain it to a person that if you do activities and you're exhausted, that's how I feel without doing any activities. This is the way MS fatigue, which we do not understand still very well. There's different theories about what causes MS fatigue. We do not understand it very well, but we do know that people might have to take naps more often or rest, that people are also heat sensitive. Those things are things that people don't always appreciate. But carrying a booklet to explain to people, and then if they don't want to read the book, then these are people that are toxic people sometimes, and maybe we need to find more compassionate people around us.
That's good advice. And for a person who very much wants to be active, are there any recommendations for treatment of fatigue that's chronic?
Yeah, the one thing that you would hear me talk about regularly, and I spoke about it before tonight, is exercise. So there is no doubt that physical exercise has amazing benefits in people with MS. Physical exercise improves endurance. So that's the first thing. There's a direct benefit of physical exercise, and everybody can do some exercise. And for exercise to succeed, people need to find the exercise that they like and enjoy and are comfortable with. So they might need to go through a whole different set of exercises before they finally settle on what they like. Just like a diet, you finally find foods that you like and then you eat them and enjoy them. And so it is with exercise. People need to find the right exercises, the right cool environment or whatever environment they need. So exercise is very important to help with fatigue. And then emotions, managing emotions. If someone is emotionally drained and stress has a large effect on MS. So learning how to deal with emotions, counseling people, meditating, mindfulness, whatever way they need to deal with emotions. And finally, eating the right foods. All of those things that we've spoken about before, the same repetitive theme, all of those things are the things that help with fatigue. That's number one. Number two with fatigue is to make sure that the fatigue is from the MS. Somebody with MS could have fatigue from other causes. For example, if someone doesn't sleep well, they might be exhausted because they don't sleep well. So we need to address their sleep. Or they might wake up during the night because they have a bladder problem. So the actual problem is their bladder. Their bladder wakes them up half a dozen times, so they're exhausted the next day. Or they might be on a medication that causes fatigue, like an antidepressant, or a seizure medication, or some other medication that affects fatigue. So we always need to look for other causes of their fatigue. They might have a medical condition like thyroid disease. So we should always seek out other causes to see if we can treat the fatigue by looking for other causes. And finally, if we've dealt with all the matters that I've just discussed, then we might come to using some medications that we use for fatigue, and we do have several medications that we use for fatigue.
Okay, that's great to know. And another question, can you discuss issues with decreased libido both in men and women in relation to MS?
Sexual dysfunction is not an uncommon problem in MS for a variety of reasons, both mental and physical reasons. So there are ways of helping people. Again, it's the same kind of strategy. So firstly, we need to look at it, try and separate out, is it the MS or are there other factors involved? For example, in a relationship, is there some breakdown in the relationship? Is there a lack of support in the relationship? Are there other factors? Is there a medication, for example, an antidepressant that is contributing to the lack of libido? So we always need to address medications or emotional factors, as well as are there physical factors. Does someone have bladder problems, bladder control problems, incontinence, and things like that that cause them to eventually lose the will and the desire? And so we analyze all the problems, try and see what's happening, what's causing the problem. Is it physical? Is it emotional? Is it unrelated to physical or emotional factors? Is it medications? And then seek help the appropriate way. Should someone see a urologist? Should they see a counselor? And then we also have people that are sex therapists who can talk to people and try and encourage them and give them advice. If the problem is not a physical one, but a mental one, there are sex therapists out there, trained psychologists, who can try and attempt to help people to overcome these problems with libido, for example.
Okay, thank you. And you mentioned antidepressants. Moving towards mental health, how common do you feel that depression is occurring for people living with MS, specifically young adults living with MS? And is there a correlation between a higher rate of depression and how long you have had the diagnosis?
So depression is very common in MS. Many times people will say, well, you've got MS. It's not surprising that you're depressed. It's not, it's not unexpected. You've got this, chronic condition, and you're concerned about your future. So it's not surprising that you should be depressed. That would be a reaction to your condition, maybe not unexpected in some times. In addition to that, though, people with MS just have a higher incidence of depression. Like many chronic diseases, but people with MS have a higher risk of having depression, probably some other chemical factors, pathways involved. And so overall, depression is a common situation seen with MS. And again, we're trying to manage it. I like to always try and manage things before I just pile on medications. I like to see if there's other ways we can help someone. So mental aspects, mindfulness, exercise, physical exercise, again, reduces the risk of depression, improving someone's fatigue, improving their energy, helping them sleep better, making them feel better, improving their symptoms. All of these can maybe potentially lower the risk for depression. So it's very important, again, to always address the physical and emotional needs. Ultimately, again, if there's still an ongoing problem, we would recommend counseling and then consider medications.
Okay, thank you. And how important do you feel support groups play a role for young couples as a person living with MS and their partner? Is that something that you recommend in your practice?
I'd mentioned earlier that MS is like a team disease.
Yes.
And what I meant by that is that the better the support someone has, and there's been studies to show this, that the better the support surrounding someone, the better that they do. And that starts with their immediate family, which hopefully would be very supportive. And I see people that do not have supportive families, that have toxic families, who don't understand them. For example, the booklet I mentioned earlier about, but you look so good. Sometimes a person might tell me that they could take it home and show it to a spouse or significant other, and the person wouldn't even bother to look at it. It's a very worrisome finding, a very worrisome sign of the future of this relationship. So supportive family, supportive spouse, supportive children, any supportive family member is very important. Supportive friends. Some people may have very good friends surrounding them. So these are the immediate people around you, friends and family. Then you go out into the healthcare team, speaking to a healthcare team, neurologists, nurse practitioners, as a big healthcare team. And then you go out into the community and you have support groups. And there are variable support groups. Some of them are very good, some of them are not as good. But many people go to support groups and find good support in the support group. So the support group is one aspect of the entire support surrounding somebody.
Okay, thank you. And I'm going to wrap up our questions with a final question here. Do you have suggestions to help individuals who are having processing issues, having issues with organization of thoughts, and planning for things like school, work, college organization aspects like that?
So again, the approach you use is depending on where someone's stage in life is. You mentioned a few things over there. So there's a difference between someone who, for example, is at college. We can help them with, as I'd mentioned earlier, we can help them with writing letters for them and saying to the administrators that this person needs, more time. This person needs to be in a cool environment. This person needs things to help them able to do all these duties. That they're quite capable of doing them, but they need more time. They can't be stressed out. Give them time, give them the right temperature, and help them in that way. Then we see people that are in a home environment and are totally disorganized with bills, disorganized, just clutter. And people have written about clutter and disorganization with MS. And so we try and talk to people about trying to be organized, avoiding clutter, avoiding multitasking. Very important to avoid multitasking. We can send them for cognitive rehab. We can teach them about other things that some may be able to use. Some people are able to make notes on an iPhone. If not, there's certainly nothing wrong in making notes in a notebook, using a calendar, using aids like that to remember. If people make notes of things, for example, write down appointments, it's one less stress for them to have to think about, and then they can concentrate on other things. So trying to be organized and helping someone with that, directing them, giving them advice, and maybe recommending them for some cognitive rehab if necessary. Mentally active, physically active, all those things help.
Well, thank you for those excellent recommendations. And we would like to thank you for joining us tonight and bringing all of your expertise to our audience and for being here for this very important topic. Thank you, Dr. Steingo.
Okay, you're welcome. Thank you.
Okay. And I believe Anna has some closing comments for all of us tonight. Anna?
Hey, Jennifer, thank you so much.
You're
And thank
welcome.
you, Dr. Steingo. You gave some awesome and wonderful tips, both for young adults living with MS and for anybody living with MS. So thank you so much for that.
Okay, you're welcome. Thank you.
And thank you to all of you who have joined us today on MS Neuro TV. We really appreciate that you've joined us today. We'd really appreciate it if you could please complete the short 1-minute survey that will appear after the webinar has finished. Your feedback is important to us so that we can continue to customize our events around you. Next month's topic is Access to Care and Resources, Getting Your Needs Met with Dr. Mitzi Williams. This webinar will be on Tuesday, March 5th at 8:00 p.m. Eastern Standard Time. Those of you who are joining us live are already registered for the entire series, so just keep an eye out for our reminder emails for instructions on how to join our next webinar on March 5th. If you're watching us on YouTube and not registered for this series yet, you can find the registration link in this video's YouTube description. All MS Neuro TV webinars, including tonight's recording, can be found on our YouTube Learning channel within the week. So make sure you subscribe to our channel and turn on your notifications so that you can get alerts on our latest MS videos. And if you're enjoying these webinars so far, please visit our website and sign up to receive notifications on our free educational events near you. Plus, receive interesting articles on what's new in the world of multiple sclerosis. You can sign up by visiting us at www.msviewsandnews.org and follow us on Facebook, Instagram, and Twitter. We'd also like to thank Celgene and viewers like you for your ongoing support to make this program possible. Thank you so much. Have a good night.